Hi, my name is Nicolette Lambert with Birth Multiverse, and we are going to start our lecture on labor. And we're going to start with induction, because induction is a really big part of labor in the United States and many other developed countries around the world. And we want to make sure that if an induction does happen, that it's necessary. So, what are medical reasons for an induction? You can have a pregnancy last longer than 42 weeks. Placenta is separating from the uterus. This is also known as placental abruption. An infection of the uterus, hypertensive disorders of pregnancy, your water breaks, but there aren't any contractions happening, health problems like diabetes that could harm you or your baby. Baby has a growth problem is another thing, and sometimes Rh disease. Now, it's important to know that not all of these conditions are an automatic induction. Most of these situations can be handled without an induction, but sometimes they do require them. Some moms go to 43 weeks just fine. Many women have spontaneous labor regardless of Rh factor. If your water breaks and contractions don't start right away, there's usually no danger as long as you don't take any baths or put anything in your vagina. In fact, my grandma says that when she was pregnant with my dad way back in the 1950s, that her water broke and she wasn't having any contractions, and she called her doctor, and the doctor said to just call him back if contractions didn't begin in 24 to 48 hours. So it's kicking it old school. So there are other ways to handle these things than an induction, but sometimes it can become necessary. In situations like a uterine infection or preeclampsia that has progressed to a life-threatening state, an induction really may be necessary. Placental abruption sometimes requires that too, because your baby's health is legitimately in danger and delivery needs to take place right away. So next up, let's talk about how do you induce, or how does your doctor induce? So the first thing you need to know about induction is that unless your cervix has ripened, the induction will very likely not be successful, and it's probably going to end up in a C-section rather than a vaginal birth. So there are pharmacological cervical ripening agents like mifepristone, relaxin, which is a synthetic oxytocin, and pitocin, dinoprostone gel, which is also called Prepidil, and those are applied directly to the cervix as a gel or a suppository. So another thing you need to know about is called the Bishop score. So a Bishop score is a scale for gauging how likely a patient is to achieve a successful induction. Components of a Bishop score include dilation, effacement, station of the baby, consistency of the cervix, position of the cervix, and a Bishop score of 8 or higher is associated with a successful vaginal birth. But if you have a Bishop score of 6 or lower, that's associated with a failed induction and a likely C-section. And you can refer to the handout on the Bishop score to see how that all breaks down. So let's also talk for just a minute, a special note on misoprostol, which is also known as Cytotec. So Cytotec is a drug for treating stomach ulcers caused by the use of anti-inflammatory drugs. But it can also be a very powerful medication to cause uterine contractions, and this has led to its use as a cervical ripening agent. Now, it has been linked to causing maternal and infant death and a uterine rupture, especially in women who have a previous C-section scar. So in August of 2000, the manufacturer of misoprostol warned against its use in pregnancy because of reports of maternal and fetal deaths when misoprostol was used to induce labor. Now, Cytotec works much faster than other ripening agents, and it causes contractions that are much more powerful than natural contractions. And doctors attribute many of these cases to the misuse and overuse of Cytotec. So their position is that it can be a good thing or can be an okay induction agent when it's used correctly or in small amounts. So you do have to be careful, though. And the timing is another factor. But the current recommendations from physicians is to use 25 micrograms of misoprostol vaginally every 4 to 6 hours for carefully selected patients in closely monitored settings. So that's one of the things that you need to know about if your OBGYN wants to induce you with Cytotec, aka misoprostol. It needs to be used correctly with the right timing and be very closely monitored, and it really probably shouldn't be used on anyone who has a previous C-section scar. So let's move on and talk about mechanical devices. Those are another way to induce labor. Hygroscopic and balloon dilators are mechanical methods of cervical ripening. Now, the idea behind these is to apply pressure to the cervix to release natural prostaglandins. And then there's another method called stripping membranes, which may or may not start labor. So refer to the handout on that one too, because it used to be used a lot, but it often doesn't start labor. So you want to be very careful about undergoing a stripping of the membranes. Another one is breaking the bag of waters, which is the technical name for it is an amniotomy. And this is also rarely effective at inducing labor. So with all these things, we're talking about using these medications and these like mechanical devices and stuff to induce labor. And so a lot of women start wondering, is there something more natural, especially with concerns about, am I going to go overdue? Am I going to go into labor at all spontaneously? So that's a big question people start having is there a natural method for inducing labor? And if you start Googling, you'll probably find a lot of stuff that is more on the old wives' tale side of things. So let's for a minute talk about natural methods and what works and what doesn't. So there are things that will not absolutely induce labor, but they could push you over the edge if your cervix is already ripe and you're very close to labor. So things like sex, you can't induce labor just by having sex. However, orgasms do release oxytocin, which is associated with kickstarting labor and helping contractions to be stronger and more powerful. And that's why, in fact, the medical field uses synthetic oxytocins, but you can make your own. Exercise is another one that you'll read. People are like, I'm going to go exercise and induce labor. You can't induce labor just by exercising, but again, it releases oxytocin. And that can also kind of push you over the edge just a little bit if you're getting to that point where the baby's close to coming. Spicy food, probably not going to make a difference. But if it tastes good, go for it. Just watch out for heartburn. So if you really are concerned about wanting to make sure your baby comes very, very close to the due date, I'd encourage you to think of this as a long game. Don't play the short game, play the long game. And look at induction as a process that you prepare for over the last trimester rather than an event that you are trying to make happen at the last minute. One thing you can do, and even a combination of things, red raspberry leaf tea. So this prepares the uterus for labor. You can drink an infusion of red raspberry leaf tea once or twice through a day throughout your second and third trimester if your pregnancy is progressing normally. If you start having preterm labor contractions, you might want to stay away from it. But it causes very, very mild contractions, similar to an orgasm. So this series of very mild contraction is kind of like a workout for your uterus. And remember, your uterus is a muscle, so you work it out and it'll help keep labor going and better. So if you think about it like running a marathon, you wouldn't just run a marathon, like walk out your door one morning and run a marathon. You would train for it. You'd start working up to it slowly, doing longer and longer runs. And the red raspberry leaf tea can kind of help your uterus do that. So there are, along with that, there are also several birth preparation herbal formulas available. For example, Dr. Christopher's Birth Prep and Nature's Sunshine 5W are a couple of really popular ones. And these can, kind of similar to red raspberry leaf tea, these contain small amounts of herbs that induce very mild uterine contractions to strengthen and tone the uterus for labor. Many mothers who take these birth prep formulas have reported going to labor a few days before, right around their due date. Now, Again, any sort of herbal supplement, you want to make sure that you are using carefully under the the watchful eye of a qualified practitioner. Don't don't use anything that could harm your baby. And a note though on these sort of herbal preparations is that you can't just take them last minute. So if you're a couple days before your due date and you're freaking out, you can't take them. They have to be started 6 weeks before the due date. So again, think of this as playing the long game. You want to prepare for labor. There are some homeopathic remedies too, like cauliflorum, simicifuga, pulsatilla, chamomilla, and arnica. They've also been used for inducing labor. There isn't a lot of research on these, just like there's not a lot of research on the herbal preparations. But there are, again, some anecdotal accounts. A note on red raspberry leaf tea is that there is actually a fair amount of research that has been done on red raspberry leaf tea, and it's a pretty widely accepted herb for pregnancy and for helping labor to go faster or just easier in general. So outside of herbs and things like that, there's also acupuncture. And most of the research available on acupuncture isn't rigorous, but it is an avenue that you can pursue with an experienced doctor of Oriental medicine. Make sure that they know what they're doing. There are certain acupuncture points that should not be used during pregnancy, and there are certain ones that can be used very carefully to induce labor. Make sure your practitioner knows what they are doing. And now let's talk about castor oil, because that's one of the big ones. So a special note on castor oil. Taking castor oil is a really controversial method for starting labor. There is some evidence that it can induce labor, but detractors say that it causes dehydration for the mother, and if you're dehydrated, that can slow down your labor. And there's also the report that it can cause irregular labor contractions. So you may not be having those consistent labor contractions that really move the baby along and keep labor going. Susan Weed, legendary herbalist, recommends that the internal use of castor oil should be accompanied by an enema and other elements in her induction protocol. So she's saying it shouldn't just be used by itself. You can find more information about that in her book, The Wise Woman Herbal for the Childbearing Year, which I think is a really great read. So do not try castor oil or any other induction technique without consulting a qualified birth professional first. So now we've kind of covered the different ways that you can get induced. Let's talk about the benefits and the risks. The main benefit of induction is that the baby gets here quicker. This can be life-saving if there is an immediate risk to the mother and baby. There are times when it is better to forego natural labor to make sure that the mother and the baby are safe. They're rare, but they do exist. But there are risks, and especially if an induction is used when there is not really a life-threatening situation. That potentially increases the risk of a C-section, which has a host of other complications that can even be long-term, lifelong. Certain methods of mechanical induction can increase your risk of infection, and then also umbilical cord prolapse and fetal injury. And so again, the bottom lines are that inductions are not risk-free. They're not a faster way to get your baby here, get done with the pregnancy. They should only be used when there's a legitimate medical threat to the mother and the baby. They are a medical procedure, and they need to be used with caution.